Oh, if you need to see a doctor and it's not an emergency, seeing a general practitioner or GP might be the better option rather than going to the hospital. So a new alliance has been formed to educate the public and help you decide when and how to make the right choices. Changi General Hospital is working with over 130 family doctors in the East under a partnership called GP First. The pilot scheme is being run by the Eastern Health Alliance, and to tell us more about it is Mr. T K Udairam, Group CEO of Changi General Hospital. So, Mr. Udairam, thank you very much for coming in today.
Thank you for having me.
So, on average, how many cases do you see at the A&E which are not, or which would not be considered emergency cases?
Okay, we see about 400 to 450 patients a day at the ED department, of which about half to a third do not require to see the ED department, but could be seen quite comfortably by a GP.
Okay, so which is why you want to help people to make the right choice, especially at the primary care level.
That's right.
So tell us more about GP First then.
Okay, GP First is a program where we encourage patients to go and see the GP first, their primary practitioner or their family doctor if they have one. And then the GP can then refer the patient to the hospital. Today, if a patient goes to the GP and then comes to the hospital, they probably have to pay between $30 to $50 at the GP clinic and then another $100 at the A&E department at CGH. But with this program, what we do is that where a patient is referred by the GP to the A&E department, we then give them a subsidy of $50. This to take away the disincentive for patients who feel that if their condition is urgent enough, they feel that they should go and see a A&E rather than going and see a GP because they will pay more by going to see a GP.
So you want patients to feel like they're not penalized for seeing their GP instead of going to the hospital in the first place. Right. But you see, for me, okay, I would only go to a GP if I really trusted that person. So you're trying to encourage more people to find that family doctor that they trust and they will want to go to as a first option instead of, you know, going to a hospital in an emergency. Is that correct?
Right. So what we do is we are working with all these GPs, and most of the GPs in Singapore are pretty well trained. They are able to take care of most of the conditions that patients have on a daily basis. So what we have is for the GPs is a system where the GP has any concern, he can call our ED department specialist 24 hours a day, 7 days a week to consult the specialist for any condition where they have a concern. So the patients can be confident that they will be well taken care of by the GP. If the GP has any concern, they will have a specialist behind them to help them.
Okay, so how are you going to, or how do you intend to get the word out about GP First?
This is the hard part. We are of course coming here and trying to make sure that the GPs, the public gets knowledge of the conditions that we have. But more, we are putting up a web space. There is a web page that they can go to where we actually put in the general conditions that can be safely seen by a GP, the conditions that can actually self-treat or self-medicate at home, and where they should go directly to the emergency department. So they have a web portal that they can go to for this. Okay,
so right now you have about 130 GPs on the scheme.
That's
right.
You
of course want to get more on board. How's that being done and what's your target?
Well, we'd like to have the 200 odd GPs in the East on the program. We have been meeting the GPs in groups and advising them of the program, informing them of the details of the program. And most GPs are supportive of the program because they see the value in patients actually going to see them rather than coming to the ED department, because most conditions can be treated by the GPs.
Okay, and one more question for you. How would patients identify the clinics which are under that scheme?
All the clinics that are under the scheme will have a decal on the in the clinics which shows GP First. It's very easy to identify.
Okay, thank you very much.
Thank you.
Pleasure speaking to you. And that was Mr. T K Udairam. If you want to find out more about GP First, you can go to their website, which he mentioned earlier. Let's go.